When the Delta variant of COVID-19 first popped up, we saw reports of cases increasing pretty quickly, but it took some time for it to become the dominant strain. But in today's Your Healthy Family, the medical director for COVID-19 at NCH Healthcare System says Omicron has roared onto the scene and is quickly becoming the predominant strain of the virus. Medical experts across the world are concerned about this variant, and Dr. Lindner says that sends a message.
Omicron went from being a few sequenced cases to the predominant variant in days.
Dr. David Lindner, the medical director for COVID-19 at NCH Healthcare System, says the Omicron variant could be up to 6 times more contagious than the Delta variant. Another reason he says it's so concerning:
there is a significant genetic distance between the Wuhan ancestral virus,
the virus all of our vaccines and monoclonal antibody treatments are based on.
People are concerned about their immunity, essentially, whether it's natural immunity from having COVID already or from getting the vaccine. So what are your thoughts on that?
There is some data out of the prior variants. It is likely that there will be a decrease in immunity compared to what we had before. How much? We don't know.
Dr. Lindner says when scientists initially studied COVID-19 vaccines, they were 94 to 95% effective against the original strain. With the Delta variant, the vaccines were 84 to 86% effective.
So let's say that this now goes down by another 3 to 5%. Well, that means that the vaccines and the immunity is still beneficial, but it is likely that we will have more breakthrough cases.
For anyone who's watching this and thinking, oh, well, the vaccine may not even be as protective against this variant, so why should I go get the vaccine? What would you say to those people?
Even if the vaccine and natural immunity lose some of their effectiveness, it is unlikely that they'll lose all of their effectiveness. The risk of being a unvaccinated, non-immune individual remains the same.
Is NCH preparing for an influx in patients similar to what we saw with the Delta variant?
We have not taken our foot off the gas pedal, so to speak, since the last surge. Unfortunately, the leadership team and all of us have expected that we would have another variant. We're all hoping it's not as bad as the last surge.
How long until you think we have those questions answered of how severe is this compared to the others, and how big of a deal is this going to be? And are we going to see that influx of patients?
It's going to be trickling over in the next few weeks. So far, we have followed Europe to a T within a month and a half to 2 months. And so if we see an increase there, we're probably going to see an increase here.
He compares the situation we're in right now with Omicron to the cone of uncertainty with a major hurricane.
We're watching, and we're staying tuned, and we're all hoping that it curves off into the Atlantic. Well, I think at this point in time, that's a really good analogy. Just like we are prepared for a hurricane, we need to prepare for the possibility that this could be a really bad actor.
A couple more takeaways from my interview with Dr. Lindner. He says Omicron has made its way to every major part of the world. And while it hasn't been reported here in Florida, it would be remiss to say it's not here yet. He says the best way to stay protected is to do what we know works, which he says is masking, washing your hands, and getting vaccinated. With today's Your Healthy Family, I'm Lisa Greenberg. And for more health stories, head to fox4now.com/yourhealthyfamily.